All right. Well, on that note, I think the first little group of questions here are appropriate enough about the media and our coverage of this law and how that might affect public perception. Does the media in an area help define the factors or myths of the ACA and covered California? Another one, ACA opponents are funding anti-reform media campaigns in other states. Is any of this happening in California? What are the best strategies to counter anti-reform opinions? I'd just say, yeah, I think definitely the media coverage will shape public opinion of this. And as Secretary Dooley said, there's this tension between people's perceptions or what they hear about the program and how it might actually affect them personally. And maybe it'll take more than a year for that to work itself out. But eventually, if the program works as designed and the groups that are targeted do benefit from it, I think that at some point people will accept that and appreciate that, even if some partisan groups are still trying to tell them that it's not good for them. I'm not aware of any specific campaigns that are being funded against it in California. There may be some national efforts with spillover here. As far as the best strategies, I'm not a media strategist. I'm a media practitioner. But if I were advising someone, I would say the best strategy is to make sure the thing works as it's designed. Because as I said earlier, I don't think there are a few parts of the program as designed that will tick off certain populations, particularly that young folks who don't qualify for the subsidies and small business owners. I think those are the two biggest groups. But most of it, if it works as designed, is going to be pretty popular. So the way for supporters to make sure it's popular is to make sure it works as designed. Do you want to say something, Vic?
The only thing I would add, I'm not aware of any of the campaigns that I've read about in other countries and the groups that are running active campaigns in other states, but I am at the very front of my mind every day is what Dan talks about in terms of the glitches. Even with the best design and the best execution, everything's not going to work perfectly all the time. And the extent to which we stumble, or the extent to which we have to make course correction and be nimble, as we have been for 2.5 years as we've built this to the point of execution, I think we might find ourselves in the forefront of campaigns in other states about California. You don't want to be like California. I think we've been on the front, and I'm anxious about the extent to which we get drawn into some of the politics in other places. I don't think anybody's going to hold us up as the shining light of excellence in states that are trying to say it's not going to work and it shouldn't work. So, I think we are going to have some places where it's not going to work as designed, and there are things about the design that aren't perfect, even in the structure of the ACA itself. But we're gonna keep doing the best we can and responding to problems as they arise and solving them where we can and moving forward. And I think that we're gonna have to get a little thick-skinned, and it's gonna be, I appreciate the caution of Mark about not creating too high an expectation for moving the needle at this time next year. That I think in 2014 and 2015 and 2016, I'm very encouraged by Dan's observations, which I share, about the fundamental rightness of the program that we're embarking on. But there are going to be some rough spots. There just are.
And I also think in terms of just the media, the dissonance from those who are opposed, I think that should be expected, even in the free media. And I expect that you're going to hear from the more conservative media sources the horror stories of people who went to covered California and something went wrong, that little glitch here and there. And I think those stories will continue to be shared no matter what the incidence is or how likely that is for any one individual to run into a problem. If it's just these minor glitches, I mean, that was characteristic of the implementation of Medicare. There were horror stories for years after Medicare was enacted about things that this and that, this particular person or that person. You just have to ride through that. And I think that's what we should all expect as this thing kind of makes its way through law.
But sometimes I think that there are, and I think that's true. There are amazing expectations that people have that, okay, January 1, healthcare costs are going to drop by 50%. Everything is going to, there'll be this magic, and all of the people who are uninsured will instantly get insured. That there won't be any kind of computer glitches and everything. And if any of those things don't happen, then you see it failed. See, we told you it didn't work. And so, I mean, that's part of being in a partisan environment. That's what that kind of debate is something that we all need to expect. I can tell you that, as Secretary Dooley says, it isn't, everything won't work exactly right on day one, but we are, just like any new program, and the president has acknowledged this as well, we're going to be, as we move along, making adjustments, fixing it, which I think is what voters expect from an organization and from a rollout of this magnitude. So controlling, being realistic, I think when you talk to real people, to consumers about it, they are realistic about what to expect. When you overlay that in a political dynamic, it becomes much more inflated and would be inflammable.
Inflammatory? Well, just to close this point, I mean, yes, small glitches may be inevitable, but if you guys flip that switch on October 1st and there's massive failure and it shuts down, people can't go on it and get even the first step done, that's going to be a huge black eye that's going to take months, if not years, to recover from. So I'm not talking about small glitches. I'm talking about, we all know the state of California has a very spotty record in the construction of computer databases, and this is maybe the most complex one it's ever tried to implement. And this one is going to have an interface with the public that some of the past computer projects have not had. So the stakes are very high for that October 1st to January 1st period. Mark, a semi-technical question that you and I